Assembly last week passed the National Health Insurance Bill, and it's for the system that will pull in funds to give all South Africans access to affordable health services. The proposed law has received mixed reactions, though. Health Minister Dr Joe Phaahla, on the other hand, has described it as one of the most revolutionary bills ever passed by the National Assembly. However, what does it mean for South Africans who are contributing towards private medical schemes? Let's discuss this with Dr Katlego Mothudi, the Managing Director of the Board of Healthcare Funders, who joins me this morning for this conversation. Doc, thank you so much for your time and good morning to you. We'll get into your perspective in just a moment with regards to the NHI bill. But I mean, let's first start with building context. How unequal and under-resourced is South Africa's healthcare system, which we are assuming and know, I think at this point, is the reason why this NHI bill has been, promoted by government?
Hi, Tumelo, and thanks for having us. The South African healthcare landscape is basically divided into two, often referred to as the two-tier system. You've got the publicly funded portion, which looks after about 85% or so of the population. And on the other side, you've got privately funded, largely by medical aid schemes, and there is a very tiny portion of people who pay for their own services, and that amounts to about 15% of the people. I think the differences are quite vast in terms of the type of access that is afforded, the services that are available, and also the purported quality of services that are given. I think we are all aware of the resource constraints that are experienced by the public sector, and also many other issues pertaining to healthcare workforce that are often deficient. You've got almost like an oversupply of practitioners and facilities on the private side.
Yeah. I mean, I often hear, the organization, the Board of Healthcare Funders, emphasizing, health system strengthening is everybody's business. Is NHI the way?
It's one of the ways, and maybe we can look at it from various angles. One, the fact that we need to move to what is called universal healthcare coverage is an area of no debate. This is a resolution that was passed a while ago, and South Africa is one of the signatories to that agreement to move the country to UHC by 2030. So there's no argument. In terms of the role that NHI plays in delivering us to that purpose, there are a number of arguments. We do recognize that there is a funding mechanism or financial mechanism that needs to deliver us to that position. NHI represents that, but it's not the only thing that should be looked at. The WHO recommends that we must look at least 5 other pillars to revamp our system or strengthen our system, and those include areas of leadership and governance, strengthening of the health workforce, making sure that there's access to medicines and vaccines, health delivery elements, etc. So just looking at NHI as the only thing that can progress us to universal healthcare coverage would be short-sighted. In terms of the bill itself, we do believe that it needs to be strengthened. You may have had many comments about the concerns that have been placed on it. Issues around governance, the role of the minister and the responsibilities around the various appointments, whether you're looking at the CEO, the boards, the various committees, etc. So there might just be too much loaded onto the minister's portfolio in terms of responsibility. There are other issues around or issues of law, whether it's in how the bill expresses itself. There are many areas that are unclear, many definitions. There are a lot of questions about what or how services will actually be provided, etc. There's also issues that have been that might be unconstitutional. Is there going to be contravention of the Constitution with respect to the role of the provinces, for example? What about the rights of the practitioners? Would the contracting processes or their accreditation also infringe on their rights to practice their craft? What about access to beneficiaries? Would Section 33, for example, which says that medical aid schemes can only provide complementary cover, not infringe on the rights of the health citizen in terms of access to healthcare? So there are quite a number of issues that have been flagged with regards to NHI, and we're saying that while we focus on the bill itself, we should not be blindsided and think that fixing even the language or these issues about the bill will actually fix the healthcare sector.
You're absolutely right, Doc. There seem to be a lot of questions. Maybe some of the medical aid scheme beneficiaries asking what then means for medical schemes of those South Africans, obviously contributing towards medical aid. Is that why you're concerned with the policy intent of this bill?
Yeah, that's one of the reasons. But maybe let me just say, for now, I think the main concern is what it means now. For now, the bill is still in the process of being finalized, and it may take some time. It still has to go through the parliamentary process, and also the various stakeholders will be afforded a chance to submit their comments through the National Council of Provinces. In terms of practical application, we still have to look at what will be signed into law, and after that, also the regulations and other administrative processes. But for now, the way the bill proposes the relationship between the fund and the medical scheme is concerning, in that the bill says it will provide comprehensive services, and then it itself needs to be interrogated because that cannot be defined in law. What it means, though, is that if medical aid schemes are prohibited from providing the same services that the fund will provide, it may mean that schemes will be relegated to just paying for what would be discretionary healthcare services or aesthetic or cosmetic services. And those are issues that need to be looked at. The concern really is that we know that the state does not have unlimited resources. We have seen recently during COVID that working together, we were able to circumvent some of these challenges, whether from a funding or administrative or operational perspective. Medical aid schemes and other private sector players were able to complement what the government needed to do in terms of rolling out the vaccine, admission of patients with the COVID, etc. So there is that need for collaboration.
All right, Doc, we leave it then. I appreciate you speaking to me about this. Dr Katlego Mothudi, the MD of the Board of Healthcare Funders, joining me, of course, discussing the NHI bill proposal.